To everybody. I'm Dr. P Kandapolarachchige, consultant psychiatrist from Apeksha Mahargama. I believe it is very important to have workshops like this because the management of cancer patients in primary healthcare setting is a challenge. So organizing these sort of workshops and presentations are highly important. So I highly appreciate and thank you all for inviting me to. So my topic is psychosocial aspects of cancer during COVID-19. Actually, when we talk about cancer patients, it's very common to have psychosocial issues to almost all the cancer patients, irrespective of the type of the cancer or the region or whatever. It's highly important to talk about that, how to manage and how to plan interventions to manage these psychosocial aspects in your primary setting. So I like to talk about the psychosocial issues they face and how do we plan interventions to settle their problems and to solve their stress. So my presentation is mental well-being of cancer patients or management of psychosocial issues of cancer patients, especially during this COVID pandemic, right? So before I go to talk about the COVID pandemic, I like to discuss a little bit about the common psychosocial issues or problems we see in our cancer patients, right? You all know that cancer is a very distressful situation, and when you hear that you are having a cancer, when somebody is given you a diagnosis of having a cancer, it's a great stress. I mean that you can't bear it up. When you hear that you are having the cancer, you become panic and severely anxious. It's a severe stress, right? But you do not get that sort of stress in other physical or mental illnesses like maybe heart disease or whatever. But when you are telling by somebody that you are having a cancer, it's a stress. You can't compare it with some other physical illness, even with heart disease, right? So why this cancer is a so distressful thing? So I like to talk about this little bit. Main thing is that most of the cancer patients do not having that clear idea about their illness. So that the uncertainty about their illness, maybe about the diagnosis, maybe about the treatment, side effects, prognosis, and what will happen to me with this illness, what is the progression. Most of the cancer patients do not have this idea. So they are uncertain about their illness and even with their life. So they become highly stressful because of this uncertainty. So I like to highlight these points because when we are managing these people in primary healthcare setting, we have to understand these problems. So first of all, we have to understand this psychological issue with the uncertainty. So we have to address that issue mainly. Next thing is the stigma with cancer. We know that in the general public, the idea about the cancer is not so good. Many people think that cancer is an incurable disease and there is no permanent treatment. So many people think that giving diagnosis of a cancer is similar to giving a death certificate. So this is stigma. So from the society, from the public, many people are rejected because of this stigma, and some people do not keep relationship with these people. Even some people do not talk to these people. So because of the stigma and the negativity, people become highly stressful with the cancer. Next thing is that the side effects of treatment. There are so many treatment methods, maybe a surgery, radiotherapy, or even chemotherapy. Most of the times, many people get some sort of side effects, which are very distressful. With the surgery, it may be a disability, maybe with the amputation or removal of the breast or whatever. maybe a disability, or maybe a disfigurement of the physical appearance. So this is stress. With the radiotherapy also you get the same sort of effects. And with chemotherapy, commonly we see that common side effects are nausea and vomiting, you can't eat well, and losing of hair, though change the appearance, and serious side effects like blood dyscrasias like neutropenia or whatever. So these are very distressful thing to cancer patients. Other thing is the suffering. Cancer patients suffer physically as well as psychologically, maybe due to pain, due to insomnia, inability to work, disability, or maybe mental suffering. Even though they recover from the primary cancer, when they recur or when they come to palliative stage, they have to suffer a lot sometimes throughout the life. So that suffering causes the psychological distress. At the same time, other psychosocial issues, psychological issues like responsibilities. If the patient is a breadwinner of the family, or maybe the husband or the father, so they are having a lot of responsibility about the family. If the patient is the mother, she is having responsibility within the family. So these responsibilities, maybe with finances, maybe with duties, maybe with employment, maybe with other dues, right? So inability to void with these responsibilities, they become highly stressful. Other thing is the social issues, maybe relationship issues, work with the other people, employments, traveling maybe to the hospital. Those are the social issues. So these social issues also play a significant role to increase the stress level within the patient, not only within the patient, even with the carers of, within the carers of family. So we have to understand the reasons for the stress within these cancer patients and within their family. Addition to that, there are some additional burden as well during this COVID-19 pandemic. What are they? Addition to the things we discussed, during this period, during this pandemic, COVID time, main thing is that cancer is an immunocompromised illness. Because many people know that cancer is an illness, especially with the cancer treatment, many people uh, become more susceptible to infections like COVID or whatever, viral, bacterial or whatever. So especially with the chemotherapy, their immunity become very low. They are more susceptible to infect with some other agents like virus or bacteria. So these things are highlighted within the media all the time. So people become very stressful and become panic and become anxious. Next thing is that many cancer patients, especially elderly people who are having some other comorbid conditions, may be long-term illnesses like diabetes, high blood pressure, maybe heart disease, maybe CKD, maybe bronchial asthma or wheezing. These long-term illnesses also relate with this cancer during this COVID period, because we know all these comorbid conditions, long-term illness, who are having this sort of comorbid conditions are more vulnerable to develop, to infect with this COVID virus. So these things are highlighted all the time by the health professionals or by the media. So they are, people are, especially patients and their carers are more vigilant about these things. So they become suspicious and very stressful. Next thing is the age group of the cancer people. Mostly the elderly people and children are risk according to the professionals. So all the time people are educated to protect our elderly people and children from the society, to prevent that get infected from this COVID virus. So these things are all the time go to their head, become traumatized more and more, so they become stressful. Next thing is that social restrictions given by the laws, authorities, health professionals, and the government to be housebound, to minimize the social contacts, to minimize traveling. So these social restrictions keep them housebound, so they feel very lonely, helpless, and they can't do anything. They can't go out. So they are like a special group, protected from the society. So they feel that they are helpless, and they become stressful because of these social restrictions. Next thing is that difficulties to reach their health services. We know even within the hospital premises, health services, even health staff is also under stress, and they have restricted their health services, right? Hospital staff force is also not adequate these days. They work according to the rosters. So health staff is minimal. They also try to protect themselves by wearing so many things, gadgets. So it's very difficult to reach to doctor or to the nurse, because they also keep social distance. They don't talk much to the people. So patients can't tell their ex, express their views, give their informations, tell their difficulties to help people. So because of this factor also, people become very, very stressful, even though they reach to the health services to collect their medicine and to get done their examinations. Other things, the practical difficulties within the health sector and the health service. Sometimes they don't get adequate enough medications at correct time, even though that government has imposed that postal packing and sending them. That does not happen sometimes effectively. These sort of practical situations, difficulties also there. The most important thing is that publicity induce stress and fear, because all the social media, including radios, TVs, and other social media, repeatedly traumatizing the people by telling the facts and giving information about the Sri Lankan and world data about the COVID, death rates, and uh, asking the people, especially the vulnerable people, to be protected all the time from the society. They become traumatized repeatedly. Sometimes these informations give by various channels repeatedly, again and again, showing the pictures and data, everything. So this is also a most important factor, and this stress create the stress within the patients and their families, right? Those are the additional burden given to these cancer patients and their carers, addition to the general difficulties and stressors. So what are the psychosocial issues related to cancer? These are the common issues: fear, uncertainty about the illness and diagnosis and prognosis, as we described, continuous pain, intolerable pain, maybe insomnia, feeling of helplessness and hopelessness. These are very common psychosocial, especially psychological issues related to cancer. Then the bereavement and the grief, you know, that is similar to loss. In Sinhala, it called viyoga. That grief reaction can be seen within the patient as well as within the loved ones, their carers and family members. So I am not going to describe all the things about the grief and bereavement because time is a limited factor. So Dabda is that. The grief reaction may be in various stages, like, right? Maybe patient is in denials, phase, or maybe anger, bargain, depression, or acceptance stage. At any stage, these people become very stressful because of this feeling of loss. Next thing is the developing of mental disorders like acute stress reactions, maybe anxiety or depression, or maybe adjustment disorders or adjustment reactions when they try to adjust to new environment and new situation, to the cancer as well as to the COVID pandemic. So there is an adjustment problem to many people, very difficult to adjust to the new situations. Next thing in the social difficulties we describe, many people having these psychosocial problems related to social problems and social difficulties, mainly economics, jobs, children's problems, and some other legal matters, various social issues. Those are the general psychosocial problems we see in cancer patients. Addition to that, there are some other very common psychosocial issues we see during this COVID pandemic. Most common and the most important thing is the extreme fear and the anxiety with panic. I have seen many people these days, they come to us with severe anxiety and the fear. Not only cancer patients, even within this general public, many people with or without physical or mental illness, they become panic because of this fear of COVID and fear of getting illness and the death. Especially the elderly people, very common, even very difficult to manage this extreme fear and anxiety. They can't sleep properly. They are having nightmares, terrifying dreams, and they having that anxiety features like palpitation, dryness of the mouth, tremors, instability, fear to walk. They feel that they might fall down, fainting attacks, giddiness, difficult to eat, frequent worrying thoughts, and guilty feelings. That sort of features of severe anxiety you can see in mostly in cancer patients and other comorbid conditions, chronic illnesses such as heart disease, asthma, kidney disease, like, right? So this is the commonest feature in cancer patients during this COVID pandemic, right? Next thing is that adjustment reactions, as I said, when they are in difficulty to adjust to the current new situations related to cancer and COVID, they develop various unspecific symptoms, not like anxiety or depression. There's a mixture of symptoms due to poor adjustment to situation. Maybe anxiety or fear, maybe depression, or maybe like confusion or delirious like, or maybe aggression, maybe loss of memory, various picture of symptoms they present with. Some people actually see with aggression and difficulty in control their behavioral problems. Maybe cognitive symptoms as well, like poor concentration, attention, or memory loss. So the adjustment reactions are very common during this period. As we said, many social difficulties and health related difficulties as we discussed before. Difficult to difficult to access to health services, maybe to the hospital or the clinic, difficulty managing traveling, difficult to finding money, that sort of things, and some other social problems. So these are the common psychosocial issues related to cancer during this COVID time. So these things we discuss, almost all these factors ultimately end up with the stress. So stress is the common feature of almost all of these difficulties and factors. Stress is the most common psychological abnormality present in the current world, not only in our country, everywhere in the world. That is the most common as well as difficult to manage with psychosocial management, right? So stress is the commonest thing. When people become stressful, especially the cancer patients, it's very bad. I mean that it's very difficult to manage people, not only the psychological aspect, even with the physical aspect. Mostly related to their immunity level. As you know, stress is a common factor to reduce the to impair the immunity level within our body. Biologically, stress affects almost all the biological functions within the body. They change the hormone levels within the body, especially they increase the secretion of adrenaline and steroids. They reduce the stress, they increase the stress level, and stress increases the sympathetic activity within the body. That increases the heart rate, respiratory rate. So many bad effects happen within the body. They all cause to impair the immunity level within the body of the ill people, so that badly affects the immunity level, that affects the prognosis of the cancer patients. They poorly respond to treatment because of this poor immunity, and they are more vulnerable to have more and more side effects such as blood dysplasias like neutropenia. You know that it's a common serious side effects with some of the chemotherapies to some of the people. Sometimes the neutrophil count, WBC count becomes zero. So
So
there
you
are
have
more
5 minutes.
infections and septicemia. So stress
So
really
you
causes,
have 5 more minutes.
okay, to reduce the immunity level, and they become more and more vulnerable. Their clinical condition become aggravated because of that, and they will lead to early unexpected deaths. So we have to be very careful about the stress, and we have to focus to reduce the stress level within these people. Right? So stress not within the patient, patient stress transmit to that carer stress level, and again carer stress level transmit to the patient. It's a vicious circle. So we have to break down this vicious circle to reduce the anxiety level of patient as well as family members. So what we can do, we can plan some sort of intervention through interventions. First thing is you have to improve the mental health of patient as well as carers through health education reassurance. Health education reassurance is very, very important to reduce that uncertainty, remove the uncertainty of the people. Then they will become happy and less stressful. Second thing is the psychological counseling to change their attitudes and their life pattern. Most of the people are having various attitudes, various myths, uh, and not happy, not trust about the Western medication, that sort of things. So you have to do counseling to patient as well as to the family to reduce their, to change their attitudes and behaviors and life pattern by doing the counseling, and especially to relieve their anxiety by ventilating their emotions and feelings. Psychotherapeutic approaches we can use, maybe cognitive behavior therapy, maybe relaxation, very, very important, relaxation, right? You can teach some sort of small relaxation methods, or we can discuss, we can explain them uh, through cognitive processes and to change their behavior, CBT like thing, and address the social needs is a must, because most of the cancer patients having social issues. So there are various agents and methods to address the social needs. Even we are having some sort of, in most of the district, most of the places, we are having psychosocial workers, social workers attached to AGA office or attached to hospital as well. So we can discuss with social workers, they will help, and they will teach how to earn the money to employ for the self-employment, etc. So many things we can do with the help of social workers and other government as well as with non-government organizations and agents, right? Other one is the spiritual and religious activities. This is a must and very important, because most of the people even do not having faith on their religion or the spiritual activity. They become very religious when they are having the cancer. It's a common thing we see here, because they do not have any other option. They try to think in within the beliefs of their religion, right? So if they are willing, we can encourage and motivate them to active within their religious beliefs. If they are Buddhist, of course, go with that various puja, spirit, dharmadeshana, bhavana, or whatever. Even with Christians and Hindus and Muslims, right? So the spiritual and religious activity is very, very important to keep them happy, especially palliative patients, to go to their end with peaceful mind. So mindfulness. I don't have time to talk much about the mindfulness. Mindfulness is the most important and well accepted psychotherapeutic method in the world, especially in venturous developed Western countries. Mindfulness is similar to meditation in our culture. So motivate them to practice mindfulness throughout, to keep their mind at present moment, because our mind is always moving here and there to past and the future, holding all the past memories, emotions, stressors, feelings, etc., and go to the future, uh, worry with so many future plans and expectations, right? So to prevent that, we have to practice mindfulness, practice them to keep their mind at the present moment without judgment. What is mindfulness? Is paying attention in a particular way on purpose in the present moment. But we have to be very careful. It should be non-judgmental. We should not judge the things at the present moment. Just watch the present moment. Keep the attention. How to do it? You can keep the awareness with your body, feelings, thoughts, or emotions at present moment without judging them. Because you know that all the present moments go to the past within few seconds, not few seconds, even you can't measure the time period that keep that present moment. Within short period goes to the past. So if you go behind the present experiences, then it will become the past. So it has to be very specific to be at the present moment without judging the experiences. So you can practice metta meditation. Metta is that opposite of the hatreds and the anger. So most of the cancer patients have the hatreds and anger towards himself and the others. So practicing metta is a very good thing, especially in our Buddhist culture. So practice them. At last, my time is over. This is the last message. When cancer patients are able to recover from home, the presence with family, friends, and family belongings, it helps them to lessen the stress, isolation, and severity of treatment side effects. So managing them in the home environment with their familial people and familial belongings, it's very grateful thing. You can help them to recover at their family environment, at the primary healthcare setting. You can help them, you can supervise them, you can judge them, you can motivate them, you can counsel them, you can help them every way, physically, psychologically, socially, as well as spiritually, right? So my time is over. Thank you very much. I don't know whether you have the time. I can give you a few minutes if you have